There are moments in a woman's life when her body whispers something before her mind fully understands it. A subtle shift, a quiet signal, something that feels just slightly different from everything she has known. And in that moment, that fragile, uncertain, electric moment, she has a choice. She can listen, or she can dismiss it. She can pay attention to what her body is telling her, or she can convince herself it is nothing and move on with her day. I have been a physician for decades. I have sat with thousands of women in my examination room, some hopeful, some terrified, some completely blindsided. And I have learned something that never stops amazing me. The female body knows. Before the test turns positive, before the missed period, before the conscious mind has even begun to process the possibility, the body knows. And it speaks. The question is whether we are listening. My name is Dr. Ava Brooks. I am an older woman and I am a doctor. I have dedicated my life to women's reproductive health. And today I want to talk to you about something that is both incredibly common and surprisingly misunderstood. The earliest signs of pregnancy. Not the classic symptoms you read about in a pamphlet at the doctor's office. Not the dramatic movie scene morning sickness that announces itself unmistakably. The real, subtle, often missed first signals that your body sends in those earliest days, sometimes before you have even missed a period. The signs that, if ignored, could mean the difference between early, attentive prenatal care and delayed care, between peace of mind and weeks of anxiety, between knowing and not knowing. That I want to be very clear about something before we go any further. This is not a video about telling you that you are definitely pregnant. Every woman's body is different. Every pregnancy is different. Even the same woman can have completely different early symptoms from one pregnancy to the next. What I am sharing with you today is based on decades of clinical experience, on the stories of thousands of patients, and on the best available medical evidence. But it is not a substitute for a pregnancy test, and it is certainly not a substitute for seeing your doctor. What it is an education, an empowerment, a way for you to understand your body better so that when it speaks, you recognize the language. Let us begin. The first sign I want to talk about is one that almost every woman experiences, but very few immediately connect to pregnancy. Breast changes. And I am not talking about the kind of breast tenderness that some women get right before their period. I am talking about something different, something more intense, something that women often describe to me with a kind of bewildered surprise, as if their own body has suddenly become unfamiliar to them. Here is what happens. Within days of conception, sometimes as early as 1 to 2 weeks, the hormonal surge of early pregnancy begins to transform the breast tissue. Estrogen and progesterone levels rise rapidly. Blood flow to the breasts increases dramatically. The milk ducts begin to expand and multiply. And the result is a constellation of sensations that can be genuinely startling. Women describe it to me as a heaviness, a fullness that feels different from premenstrual swelling. It is not just that the breasts are tender, although they often are, but that they feel dense, weighty, almost engorged. Some women say it feels like their breasts have doubled in weight overnight. The nipples may become exquisitely sensitive. Some women tell me they cannot bear to have anything touch them. Not a bra, not a shirt, not a shower stream. The areola, the darker skin around the nipple, may begin to darken further and expand. Tiny bumps called Montgomery's tubercles may become more prominent. These are the glands that produce lubricating oils for breastfeeding, and they can become visible very early. Now here is the critical distinction. Premenstrual breast tenderness tends to be bilateral, somewhat predictable, and it usually resolves or lessens once your period starts. Early pregnancy breast changes are often more intense, more persistent, and they do not go away. If your period is late and your breasts still feel heavy and tender in a way that is unusual for you, pay attention. That is your body talking. I remember a patient. Let me call her Sarah. Sarah was 29, a teacher, and she came to see me because she thought she might have a hormonal imbalance. Her breasts had been sore for 2 weeks, she was exhausted, and she just felt off. She had convinced herself it was stress, or maybe a thyroid issue, or maybe she was just getting older. She had not even considered pregnancy because she and her husband had been trying for over a year with no success, and she had started to believe it might never happen. I examined her, I listened to her symptoms, and I said, "Sarah, before we run a full hormonal panel, let's do a pregnancy test." She looked at me like I was being naive. She had taken tests before, she said. They were always negative. But something about what she was describing, the intensity of the breast changes, the persistence, the way she said she felt different, not just sore, made me insist. The test was positive. She was 5 weeks pregnant. She sat in my office and wept. Not from sadness. From shock. From relief. From the overwhelming realization that her body had been telling her for 2 weeks, and she had not believed it. That is why I want you to know about breast changes. Because your body does not lie. It sends signals. And one of the loudest, earliest signals it can send is happening right there on your chest. Now let me move to the second sign. And this one is tricky because it mimics something that many women experience regularly and have learned to dismiss. Fatigue. But not regular fatigue. Not the kind of tired you feel after a long work week or a late night or a hard workout. Pregnancy fatigue is different. It is profound. It is bone deep. It is the kind of exhaustion that makes you feel like you have been drugged. Here is why it happens. In the earliest weeks of pregnancy, your body is undertaking a construction project of staggering proportions. It is building the placenta, an entirely new organ, from scratch. It is dramatically increasing blood volume. It is restructuring blood vessels. And it is doing all of this while progesterone levels surge to levels that would, in any other context, be considered sedating. Progesterone is a central nervous system depressant. It slows everything down. It makes you sleepy. And in early pregnancy, progesterone levels skyrocket. The result is a fatigue that women consistently describe to me as unlike anything they have felt before. It is not just being tired. It is feeling like you could fall asleep standing up. Like your limbs are made of lead. Like no amount of sleep is ever enough. Women tell me they go to bed at 8 p.m., sleep 10 hours, and wake up feeling like they have not slept at all. They tell me they find themselves fighting to stay awake at their desks in the middle of the afternoon in a way that has never happened before. They tell me their partners notice, "You seem so tired lately, are you okay?" The important thing to understand is that this fatigue can begin astonishingly early, within a week of conception for some women. Definitely by the second or third week. And because it often starts before a missed period, it is extremely easy to attribute to other causes. Work stress, not sleeping well, coming down with something, the changing seasons. You can always find a reason to explain away fatigue. But when fatigue is combined with other subtle changes, when it is deeper than your usual tiredness, more persistent, less responsive to rest, it deserves your attention. Your body is not lazy. It is not weak. It is directing an enormous amount of energy toward the most important biological project it has ever undertaken. And that takes everything you have. I want to tell you about another patient. Maria. Maria was a 34-year-old accountant, and she came to see me because she was worried she was developing chronic fatigue syndrome. She had been so exhausted for the past 2 weeks that she could barely function. She was falling asleep at her desk. She had stopped going to the gym, something she had done religiously for years, because she simply could not summon the energy. She was terrified that something was seriously wrong. I asked her a series of questions. When was your last period? She was not sure. Her cycles had always been irregular, so tracking was difficult. Any other symptoms? She mentioned, almost as an afterthought, that her breasts had been unusually sore, and that certain smells, coffee, her husband's cologne, had been making her nauseous. I sent her for a pregnancy test. It was positive. Her body was not sick. It was pregnant. And the fatigue she had been so worried about was actually a sign that everything was working exactly as it should. This is why I want you to understand pregnancy fatigue. Because if you do not know to look for it, you will explain it away. And while a few extra weeks of not knowing you are pregnant might not seem like a big deal, those early weeks are critical for fetal development. They are when the neural tube is forming, when major organs are beginning to develop, when the foundations of your baby's health are being laid. Knowing early means you can start prenatal vitamins early, especially folic acid, which dramatically reduces the risk of neural tube defects. It means you can eliminate alcohol immediately. It means you can review any medications you are taking with your doctor. Early knowledge is not just about peace of mind. It is about giving your baby the best possible start, The third sign I want to discuss is one that most people associate with later pregnancy, but which can actually begin remarkably early. Nausea. But I need to be precise about what I mean here because early pregnancy nausea is often not what you expect. When most people think of morning sickness, they imagine a woman rushing to the bathroom, violently ill, unable to keep anything down. And yes, for some women, that is the experience. But for many, perhaps most, early pregnancy nausea is much more subtle. It is a low-level queasiness that sits in the background of your day. It is an aversion to foods you normally love. It is a sudden, inexplicable sensitivity to smells that never bothered you before. The coffee you have enjoyed every morning for 15 years suddenly makes your stomach turn. Your partner's familiar scent, which you have always found comforting, now makes you feel vaguely ill. For reasons that are not entirely understood, elevated HCG triggers the nausea response in many women. The leading theory is that it serves an evolutionary protective function, making pregnant women averse to potentially harmful foods and environmental exposures during the critical early weeks of fetal development. Your nausea is your body's way of protecting your baby, even before you know the baby exists. What I want you to understand is that this nausea can start very early, often around the time of the missed period, sometimes even before. And it is not always present as classic vomiting. For many women, it is more like a constant, low-grade car sickness. A sense that your stomach is unsettled. A feeling of being off. And smell sensitivity is often the very first component of. She worked with coffee every day. She loved the smell. It was part of her identity. And then one morning she walked into the cafe and the smell made her gag. She thought she was going crazy. She tried switching to tea, but even that was making her queasy. Then she noticed that her roommate's cooking, which she normally enjoyed, was suddenly intolerable. She was not throwing up.
She was not sick in the traditional sense.
She just felt wrong, nauseated, unsettled. I asked her about her cycle, and she realized she was a few days late. The pregnancy test was positive. The coffee aversion lasted through her first trimester and then, mercifully, subsided. But that was her first signal. Her body telling her, before she had any idea, that something fundamental had changed. If you are noticing that your relationship with food and smells has shifted, especially if it is combined with fatigue, breast tenderness, or a missed period, do not dismiss it as a stomach bug or a weird phase. It might be the earliest whisper of a new life. Now I want to discuss the fourth sign. And this is the one that I think is most commonly misunderstood and most frequently dismissed. Implantation bleeding and cramping. Let me explain what this is, because it is not what many women expect, and misunderstanding it can lead to significant confusion. When a fertilized egg travels through the fallopian tube and reaches the uterus, it does not just float there. It burrows. It implants itself into the thickened, blood-rich lining of the uterus, the endometrium, and begins the process of establishing a connection to the maternal blood supply. This process, called implantation, typically occurs about 6 to 12 days after conception. And for some women, not all, but some, it causes very light spotting or bleeding. This is not a period. It is typically much lighter. It may be pinkish or brownish rather than bright red. It may last only a few hours or up to a day or two. It does not involve clots. It is not heavy enough to require a pad or tampon. And it occurs earlier than a normal menstrual period would, often around the time you might expect your period, which is why it is so frequently mistaken for a light or early period. This confusion has real consequences. I have had patients who experienced implantation bleeding, assumed it was their period, and went months without realizing they were pregnant. They missed the entire first trimester of prenatal care. They did not start prenatal vitamins. They did not make the dietary and lifestyle adjustments that support early fetal development. And they spent weeks or months experiencing pregnancy symptoms, fatigue, nausea, breast changes. Without understanding what was happening to them, along with the spotting, some women experience mild cramping during implantation. It is usually described as a pulling, tugging, or mild aching sensation in the lower abdomen. It is different from menstrual cramps, typically milder, more localized, less rhythmic. Some women say it feels like a twinge, a quick, sharp sensation that passes quickly. Others describe a dull ache that persists for a day or two. This is the sensation of the embryo embedding itself into the uterine lining. It is the very first physical sensation of pregnancy for some women. I remember a patient. Let me call her Diane. Diane was trying to conceive, and she was tracking everything: ovulation, timing, symptoms. About 10 days after ovulation, she noticed a tiny amount of pink spotting, just a trace when she wiped. She also felt some mild cramping that she described as fluttery, not painful, just present. She was devastated because she assumed it was her period arriving early. She called my office almost in tears, convinced that another cycle had failed. I asked her to describe the bleeding. How heavy was it? What color? How long did it last? As she described it, barely there, pinkish, already gone, I told her, Diane, this might not be your period. Come in for a blood test. Her HCG levels confirmed she was pregnant. What she had interpreted as failure was actually success. Her body was not telling her that she was not pregnant. It was telling her that she was. This is why understanding implantation bleeding is so important, because it does not look like what you expect a period to look like. It looks like something you could easily dismiss. And dismissing it could mean losing precious weeks of early pregnancy care. Now, I have described 4 signs: breast changes, profound fatigue, nausea and smell sensitivity, implantation bleeding and cramping. These are the earliest, most common, and most frequently overlooked signals of pregnancy. But I want to be very clear. You may not experience all of them. You may experience none of them. Some women sail through the first weeks of pregnancy with no symptoms at all and only discover they are pregnant when their period is significantly late. That is also normal. Every body responds differently to the hormonal tsunami of early pregnancy, and the presence or absence of symptoms tells you nothing about the health of the pregnancy. What I'm offering you is not a diagnostic checklist. It is a framework for paying attention, for listening, for recognizing that your body is not random and its signals are not meaningless. If you are noticing a combination of these changes, especially if they are unusual for you, especially if they persist, especially if your period is late, take a test. See your doctor. Do not talk yourself out of it because you are afraid of being wrong, or because you think you are being dramatic, or because someone told you pregnancy symptoms do not start this early. They can. They do. I have seen it thousands of times. I also want to mention a few other early signs that deserve your attention, even though they are less common. A metallic taste in the mouth. Some women describe it as sucking on pennies. This is called dysgeusia, and it is related to hormonal changes. Increased urination. You might find yourself needing to pee more often, even before a missed period. This is because increased blood flow to the kidneys and the growing uterus pressing on the bladder both begin surprisingly early. Dizziness or lightheadedness. Blood vessels dilate in early pregnancy, which can lower blood pressure and make you feel faint. Constipation. Progesterone slows down the digestive tract. Mood changes. The hormonal shifts can make you feel unusually emotional, irritable, or weepy. A heightened sense of smell, even without nausea. Food cravings or aversions. A strange, persistent taste in your mouth. Headaches. Backaches. All of these can be part of the picture. The point is not to memorize every possible symptom. The point is to know yourself well enough to recognize when something is different, and to trust that recognition enough to act on it. Let me take a moment to address something important: the anxiety of waiting. If you are trying to conceive, the 2 weeks between ovulation and your expected period, what many call the 2-week wait, can be excruciating. Every sensation is amplified. Every twinge is analyzed. You are hyper-aware of your body in a way that is both a gift and a curse. And I want you to know that the stress you feel during that time is completely normal. It does not mean you are obsessive or crazy. It means you care deeply about something that matters enormously. Give yourself grace during that time. Find distractions. Talk to someone you trust. Do not Google every symptom at 3 in the morning. It will not give you answers. It will only give you anxiety. The only thing that can tell you whether you are pregnant is a test and a doctor's confirmation. Everything else is speculation. And if you are not trying to conceive, if pregnancy is not something you want or are ready for, these signs are still important to know. Because early recognition gives you options. It gives you time to think, to decide, to seek counsel, to make the choice that is right for you. Whatever that choice is, whatever your circumstances, Knowing early is better than knowing late. Knowledge is always power. That I want to speak directly to the women who have been trying for a long time. The women who have seen negative test after negative test. The women who have started to believe it might never happen. I see you. I have sat with you in my office. I have held your hands while you cried. And I want to tell you something that is both hopeful and hard. Sometimes the symptoms you are feeling are real. They are not in your head. They are not wishful thinking. But they also might not mean what you desperately want them to mean. Early pregnancy symptoms and premenstrual symptoms are maddeningly similar because they are caused by the same hormone, progesterone, which rises in the second half of every menstrual cycle, whether or not conception has occurred. This is why symptom spotting can drive you crazy. This is why the 2-week wait is so brutal. The bloating, the breast tenderness, the fatigue, the cramping, these can all happen in a normal cycle. They are not imaginary. They are real physiological responses to real hormonal changes. But they are not proof of pregnancy. The only proof is a positive test confirmed by rising HCG levels. That if you are in this situation, if you are trying, if you are hoping, if you are symptom spotting, please be gentle with yourself. Protect your heart. Do not interpret every sensation as a sign. Do not crash emotionally every time your period arrives. Hope is a beautiful thing. It is also a vulnerable thing. Hold it carefully. Now I want to talk about what to do if you notice these signs and suspect you might be pregnant. First, take a home pregnancy test. They are reliable, they are accessible, and they give you an answer within minutes. For the most accurate result, take the test first thing in the morning when your urine is most concentrated. If it is positive, or if it is negative but your period still does not come and your symptoms persist, call your doctor. Schedule that first prenatal appointment. Start taking a prenatal vitamin with at least 400 micrograms of folic acid immediately. Avoid alcohol, quit smoking if you smoke, and review any medications you are taking with your healthcare provider.
Eat well.
Stay hydrated.
Get rest.
And begin the journey of caring for yourself and the life that may be growing inside you. I also want to address something that is rarely talked about openly. Not every pregnancy is planned. Not every pregnancy is wanted. And if you find yourself looking at a positive test and feeling fear, or despair, or overwhelm rather than joy, that is okay. You are not a bad person. You are a human being facing an enormously consequential situation. You do not have to figure it out alone. There are counselors. There are hotlines. There are trusted people in your life who love you and will support you, even if you are scared to tell them. Whatever you decide, whatever path you choose, please do not isolate yourself. Please do not try to carry this weight without help. And please do not delay care. Early prenatal care is important whether you plan to continue the pregnancy or not. Your health matters, regardless of your circumstances. There is something else I want to say, and it comes from decades of listening to women. Your intuition matters. I cannot tell you how many times a patient has sat in my office and said some version of, "I just knew. I felt different. I cannot explain it. I just knew something had changed." And she was right. The female body and the female intuition are not separate things. They are deeply connected. Your body sends signals that your conscious mind may not fully register, but somewhere deeper, somewhere older and wiser, you perceive them. Do not dismiss that feeling. Do not let anyone tell you it is all in your head. If you feel different, pay attention. Investigate. Trust yourself enough to find out that. I want to close with a reflection. Pregnancy is one of the most profound experiences a human body can undergo. In the space of 9 months, a single cell becomes a breathing, crying, grasping human being. And the body orchestrates this miracle with astonishing precision, adapting, shifting, building, nurturing. The earliest signs of this process are subtle, but they are not accidental. They are the opening notes of a symphony that will build and swell and transform over 40 weeks. Learning to hear those opening notes, learning to recognize what your body is telling you, is one of the most empowering things you can do for yourself as a woman. You do not need to be hypervigilant. You do not need to live in a state of constant body monitoring. But you do need to know what is normal for you so that you can recognize what is not. You need to trust yourself enough to investigate when something feels different. And you need to give yourself permission to hope, to fear, to wonder, and to seek answers. My name is Dr. Ava Brooks. I am an older woman and I am a physician. I hope this conversation has helped you understand your body a little better. I hope it has given you language for things you may have felt but could not name. And I hope that the next time your body whispers something to you, whether it is about pregnancy or anything else, you'll be ready to listen. Take care of yourself. Trust your body. And I will see you